deadlier strain of Mpox is spreading rapidly across Central and East Africa. The Democratic Republic of Congo, DRC, is at the epicenter, with over 14,000 reported cases and 511 deaths. The virus has now reached Burundi, Kenya, Rwanda, and Uganda. This surge in cases has sparked significant concern among global health officials. The World Health Organization, WHO, is closely monitoring the situation and plans to convene an emergency committee to determine if this outbreak qualifies as a public health emergency of international concern. The implications of such a declaration are vast, potentially mobilizing international resources and support to combat the outbreak. The U.S. Centers for Disease Control and Prevention, CDC, has also issued a health advisory. This advisory urges healthcare professionals to maintain a heightened index of suspicion for Mpox symptoms, especially in individuals WHO have recently traveled from the DRC or its bordering nations. This vigilance is crucial in early detection and containment efforts. Mpox, formerly known as monkeypox, is a viral disease that spreads easily between people and from infected animals. It can be transmitted through close contact, such as touching, kissing, or sexual activities. Additionally, contaminated materials like sheets, clothing, and needles can also pose a transmission risk. Symptoms of Mpox include fever, a painful rash, headache, muscle and back pain, low energy, and enlarged lymph nodes. These symptoms can vary in severity, but the potential for severe outcomes, especially with the Clade Y strain, makes it a significant public health threat. Historically, Mpox was mostly confined to Central and West Africa. However, in 2022, it spread to Europe and North America, raising global awareness and concern. This spread highlighted the potential for Mpox to reach beyond its traditional boundaries, prompting increased surveillance and preventive measures worldwide. Mpox is categorized into two genetic clades, Clade Thyroid and Clade 2. Clade Y, particularly Clade Ib, has been responsible for the severe outbreak in the DRC. Although Clade Y is more deadly, there is no evidence to suggest it is more transmissible than other strains. This distinction is critical for understanding the dynamics of the outbreak and tailoring response strategies accordingly. Since January 2023, the DRC has reported over 22,000 suspected cases of Clade Bu Mpox, resulting in more than 1,200 deaths. The number of cases reported in the first 6 months of this year alone matches the total for all of last year, indicating a rapid escalation in the outbreak's severity. WHO Director General Dr. Tedros Adhanom Ghebreyesus emphasized the need for a comprehensive and international response to halt the virus's spread. The risk to the general population in the region remains moderate, but it is high within the DRC. This high-risk classification underscores the urgent need for targeted interventions and support to contain the virus within the affected areas. No cases of Clade I Mpox have been reported outside Central and East Africa. The CDC classifies the risk of the virus entering the U.S. as very low. However, the agency continues to recommend vaccination for those at high risk of exposure. Vaccination remains a crucial tool in preventing the spread and mitigating the impact of Mpox, especially in vulnerable populations. To expedite vaccine access in lower-income countries, the WHO has started the emergency use listing process for approved Mpox vaccines. Both Nigeria and the DRC have already approved these vaccines for emergency use. This step is vital in ensuring that effective vaccines are available where they are most needed, helping to curb the outbreak's spread. The WHO has been working closely with local governments and health organizations in the affected regions to implement effective containment measures. This includes training healthcare workers on Mpox identification and treatment, increasing public awareness about the disease, and establishing isolation facilities for those infected. These measures are designed to reduce transmission rates and provide better care for those affected. The CDC advises anyone WHO has traveled to the DRC or neighboring countries in the past 21 days and developed an unexplained rash to seek medical care immediately and avoid contact with others. Early detection and isolation are key strategies in preventing further transmission of Mpox. Public health officials stress the importance of not stigmatizing individuals WHO may be affected, as this can hinder reporting and containment efforts. Stopping the transmission of Mpox will require coordinated international efforts. The WHO has developed a regional response plan requiring 15 million danryu and has already released $1 million from its contingency fund for emergencies. This funding is essential to support immediate response activities, including surveillance, vaccination, and public health messaging. Effective use of these funds can significantly impact the course of the outbreak. Dr. Michael Ryan, WHO's Health Emergencies Program Executive Director, stressed the importance of understanding and containing the virus. He highlighted the lack of international funding during the large-scale outbreak and the need for better global preparedness. Dr. Ryan emphasized that Mpox is a virus that can be contained effectively if the right measures are implemented promptly and universally. International support and cooperation are crucial in quelling this outbreak. The virus can be contained effectively if the right measures are implemented promptly and universally. This includes robust surveillance, rapid response teams, and widespread vaccination efforts. Collaborative efforts between countries, international organizations, and local communities are essential to control the outbreak and prevent further spread. The fight against Mpox is a collective effort that requires dedication from all sectors of society. Governments, health organizations, scientists, and citizens must work together to navigate this challenging situation. The lessons learned from this outbreak will inform future public health strategies and enhance global resilience against emerging infectious diseases. Stay informed, stay safe. Don't forget to like, share, and subscribe to our channel for more important health updates.